When you first enter any of the departments or wards, please make your way to the receptionist to book in. You may be asked to take a seat in the waiting area. Parking concessions apply for some treatments, and further information on this can be found within the department you're attending. Please note, visiting rules differ for each department. For further information, please contact the department that you will be attending. Before your first treatment, you will have an appointment with your clinical nurse specialist, or a chemotherapy and immunotherapy trained nurse called a pre-treatment assessment. During this appointment, we will discuss the treatment in more detail, including the potential effects of your treatment and the acute oncology service and patient alert cards, give you information on additional medications you will be given, and also give you the opportunity to ask any questions you may have. Treatment may be given orally as tablets or as an injection intravenously into your vein. We will provide you with written information on your treatment, which can also be found on the Macmillan Cancer Support website. For this video, we will show you what happens when having treatment at the Arden Centre. On the day of your treatment, once you have checked in with the receptionist, you will be called through to the treatment area. We will record your weight, and we will also take your observations, which include blood pressure, pulse and temperature. Your nurse will then talk you through the process for the day. If you are having treatment into your vein, we will use a cannula or a long-term device in order to administer the treatment. If using a cannula, these are inserted and removed on the same day.
It's just a bit of alcohol wipe just to clean the area.
If we use a long-term device, this will be inserted before your systemic anti-cancer therapy commences. Examples of long-term devices are a PICC line, Portacath or Hickman line. These remain in place for the duration of your systemic anti-cancer therapy and are accessed each time you attend for treatment. If a long-term device is required to administer your treatment, this will be discussed with you during your clinic appointment with your consultant. Once we have access to your vein, a bag of fluid will be connected, which we call a flush. This is something called saline, which keeps your vein open in readiness to begin your treatment. Trained nurses will be in the room at all times throughout your treatment. Anti-cancer medications are prescribed based on your specific type of cancer. The dose of treatment you receive is calculated using your height, weight, and sometimes your blood results. Some treatments are made in our pharmacy aseptic lab on the day of your treatment, and other treatments are made before you attend for your appointment. You will be advised when to have a blood test prior to your treatments, and it is important that you get your blood test taken on time, as this will prevent delays on the day you attend. Before we give you any medication, we will always ask you to confirm your full name, date of birth and first line of your address. We will then confirm your hospital number and commence your treatment. You will be asked to confirm these details a number of times throughout the day. You may receive other types of medications prior to commencing your anti-cancer treatment. These are given to prevent some of the potential side effects of treatment, for example, anti-sickness. The length of treatment will differ depending on the systemic anti-cancer therapy you receive. This could be anywhere between 1 hour to an entire day. If having treatment within a day unit, you will be offered refreshments and a light lunch is provided between 12 and 1. Please feel free to bring your own food and drinks with you if you would like to. The hospital also has Wi-Fi available for you to access. Prior to leaving the department, you will be given your next appointment and a blood form, as well as instructed when to have your blood test taken. You may also be sent home with some medications to help prevent side effects. Please ensure you take any medication as prescribed. We look forward to welcoming you soon.